Rachel. How are you?
Hello, Amy. I'm very well, thank you. Good to see you.
You too, and good evening there. I know you're in Israel. I'm here in the US right now. It's middle of the day for us, so it must be late in the evening for you.
Getting late here as is. That's right.
Well, thank you so much for joining us. And folks, I just want to introduce Dr. Rachel Bachner-Melman. She's a clinical psychologist specializing in the treatment and research of eating disorders. Professor Bachner-Melman completed her doctoral thesis at the Hebrew University of Jerusalem on genetic and personality factors associated with anorexia in athletes and non-athletes. She's been a faculty member of the MA Clinical Psychology Program, at the Ruppin Academic Center in Emek Hefer since 2012 and teaches a course on eating disorders at the Hebrew University. She has rich clinical experience. She's published over 60 articles and book chapters and presents regularly at conferences in Israel and abroad. Professor Bachner-Melman is a member of the Eating Disorders Research Society, Director of Outreach of the Academy for Eating Disorders, and she's also the president of the Israel Association for Eating Disorders. Welcome, welcome, Rachel.
Thank you. That was some introduction, Amy. Now I'll have to sound semi-intelligent.
I don't think you'll have trouble with that. Well, you know, it's important to recognize all the years of work that you've put into this issue and all the focus that you've had on it. And I think from the activist, parent, affected person, survivor side, I'm very, very grateful that you are continuing to invest the energy that I think is needed in research and practice around eating disorders. So
I must say that I'm so grateful that you guys keep the energy levels up so high and keep doing what you do, because we all complement each other and it's so important.
Agreed. And we're just going to jump right in because I know you have a lot to share. I'd like to just know a little bit about what the eating disorder situation is in Israel.
We do not actually have accurate epidemiological studies, but we know the situation is not good in terms of body image and disordered eating. And when we measure all these factors in normative Israeli society, we fare at least as badly as the Western world and probably a little bit worse. So eating disorders are really, unfortunately, very rampant. Of course, there are many sections of the Israeli society. We have the factor of religion, so that secular society as opposed to traditional and religious society and ultra-Orthodox society. And then we have the Arab Palestinians and different groups of Arab people as well, and immigrants from various ethnic groups. So it's very varied. It's a fascinating society, and the eating disorders fits in differently to each separate culture.
Thank you. Yes, I can imagine you've got lots of different groups of people there, and the world changing so much as well. Rachel, the theme of World Eating Disorders Day 2020 is eating disorders can't afford to wait. They cannot afford to wait. Why is this important, and what message would you like to share to fellow clinicians, as well as families, carers, and individuals affected by eating disorders?
I suppose, first of all, the message that comes across most clearly for me is that if you notice warning signs in your child or your brother, sister, loved one, parent, whoever, don't wait. Don't wait to think that it might go away alone. Don't wait to see if it's okay. Don't wait if you're not sure. Address it, because the quicker the person receives help, the greater the chances are of it not developing into a long-term disorder that might be it might be really, really sort of blocking that person in his life, and it could even cost him his or her life. So get treatment as soon as you can. Don't wait. I guess the waiting lists in this country are very long, which is a major obstacle to treatment. So I know that all people with eating disorders, as well as professionals, we would like the system to be a little bit more efficient. We would like more services and less waiting time, so that we would not have to wait so much. And that would be really good if people could get help without waiting.
And could you talk about that a little bit in terms of access to treatment in Israel? And are there is it possible to implement evidence-based treatments like family-based therapy, family-based treatment, CBT, cognitive behavioral therapy, etc.? You have, pretty strong public health system. How would that be possible to expand?
Yes. So first of all, I will say that we do have a well-developed public health system with health funds that provide free treatment to anyone that needs it, and so that anyone with an eating disorder or any other disorder that, for that matter, can get free treatment. And it's not usually limited in time. The health funds are very generous about giving outpatient or day treatment, which has developed a lot over the past few years, or inpatient treatment when needed, to whoever needs it. So that is a good system. There's also a lot of private therapy as well, which complements it, but there is treatment available. And there is, I think, sometimes one has to look for it, and not always protocol-based, family-based therapy is available as much as it should be, but it is available in much more than it was in the past. And I think clinicians are working more with families today than they were in the past. But of course, we've always got further to go. And I think CBT is much more used and available than it was in the past, DBT as well. But we're in a process, and we tend to be a little bit behind the States in terms of offering FBT and CBT and DBT and the modalities that are much more commonly used there. But I think we have advantages here as well in terms of time not being limited for therapy, and an understanding by the system that people do need to stay for long periods of time with support, and in order not to relapse.
And you've made such good points. And as folks listening know, I spent most of my life in Africa, and when my daughter was diagnosed with anorexia within 3 or 4 months of behavior starting, luckily we could get her in early to an FBT program, but we did it all on Skype. And so I think Emma was the first patient of this therapist, who was fabulous. And I'm wondering, if you're seeing changes as a result of COVID-19 in use of these kind of alternative delivery models for therapy.
Oh, for sure. First of all, we were all thrown into this together, and everybody had to find new modalities of reaching people, of keeping treatments ongoing, and doing whatever we could under the circumstances. And actually, we organized, the Israel Association for Eating Disorders organized a series of webinars, and we wanted to hear how all the various centers are faring, and what the challenges were, and what the advantages were, if there were any. One of the points that came up was very interesting. The work with families on the internet using Zoom and so on. Turns out that there are some advantages for that, because the Zoom comes into people's homes, and you don't have to have the people bringing their food into your office and sitting there in a very artificial way and eating their food. You can see what happens in people's homes, and the families are there, and you can understand what's going on and the dynamics, and you can actually treat people in their own setting. And that was one advantage to the COVID-19. There are not a whole lot of advantages, obviously. There are a whole lot of disadvantages, including programs having to close, and the inpatient units having to be closed as well, so that no visitors came in and no one went out, which was a big challenge. But also must have had some pluses, I think. But it was very hard for me to refer patients during that period, and to get them accepted to intensive treatment programs, because they were not rushing to accept new patients all this time. So there were lots of challenges as well.
But and it sounds like you have a really good system to be able to start that early identification. Even if folks don't have access to a facility, they can work through Skype or some other modalities. That's a really wonderful finding.
There was some confusion, I think, on the process, because the various health funds were not very quick to approve the various modalities, so that a lot of places were only working on the telephone. Others, it was rare at the beginning for the funding to be available to also work by video. It took a while, but I think we created a new routine, and there will be some things that might remain. for the better and for the worse after COVID, but we'll have a wider range of tools available.
And Rachel, I know you've done work and your research and practice on both the genetic and personality factors of anorexia nervosa. Could you tell us a little bit about the personality factors work that you've been engaged with?
Certainly. My original work was working with genetics and looking at the correlations between genetics and personality factors. And another area of my research that I'm really involved in at the moment is recovery. So I'm interested in the process and how personality factors can help people to recover, and how recover could be spoken of and conceived of and measured, and how everybody defines their own process of recovery and state of recovery. And I've invested quite a bit in trying to measure the recovery in a questionnaire that might be used, and I'm participating in other workshops on the subject of recovery as well.
This is really powerful. I don't, maybe other folks are doing this kind of work, but I know, sort of anecdotally, the activists and family community, we know that these certain traits actually are very positive if directed in the right way. So oftentimes someone with an eating disorder is told, oh, you're too obsessive, you're too perfectionist, you're this and that. And it could be anyone, any gender, any ethnicity, any age even. But we know intrinsically that these can be also positive things.
Absolutely. The determination and the absolute doggedness of getting yourself out. You need to do that 6 times a day, every meal. You have to force yourself and remind yourself that this is going to get you out of there. And of course, you've got the war going on all the time. But I think that there are certain traits, and I believe there's going to be a workshop at the AED conference now on using those traits for the benefit of recovery process.
That is
I'm
wonderful.
but I saw it's going to happen. So
okay, good. Well, we'll be looking forward to that. We are just about out of time, but I did want to give the opportunity for you to speak a little bit about what's happening in Israel for World Eating Disorders Day. And also, if you could mention a little bit around why it's important to share your story. Why is that personal narrative so important?
Okay, for me as a clinician, that's the major source of my knowledge. You can read theories, you can learn about textbooks, but the main source of knowledge for anyone about the process of recovery, about the process of therapy, about the recovery process is only people who have actually done it and are doing it themselves. And there are other disorders and challenges that are being dealt with at the same time. And if we don't hear people's stories, there's no hope. We don't know that people can get out of it. And we can also learn what's gone wrong for people and what they were missing in their process and they feel they've missed out of. So it doesn't have to always be in a happy story. And sadly, we know that the stories are not always happy. But we need to share with each other. And in this day and age, that's one thing that we have together. And the media does help us not to be alone, because once upon a time, eating disorders were very, very lonely disorders. So yes, we have that now, and we have the ability to share and to encourage and to help each other. And there's so much to be said. And where would we be? We'd be back in the Stone Age with the patriarchal, hierarchical people of the therapists saying, we know how you're going to get better and take this pill and do this and do that, which is, of course, not the way to go at all. We all need to learn first and foremost from everybody's experience and from family members, and all affected by these terrible diseases. And this is wonderful that we have World Eating Disorders Day and that you're putting everything into that. But I think one thing I'd like to say, that I hope that in the future we won't have to be pushing it so hard, because we're going to have more and more success with prevention and with treatment, and that we'll see less and less eating disorders. We're not in favor of eating disorders at all. We're against them.
Absolutely. I'm with you there. Okay, Dr. Rachel Bachner-Melman from the Ruppin Academic Center in Hebrew, University of Jerusalem. Thank you so much for joining us today.
Thank you for having me, Amy. It was lovely.